Hey, Super Mamas, it's Dr. Joy here, and you are watching Delivering Joy MD TV. Welcome to Super Mama Sunday, where we've been talking about preterm birth. And y'all, today I have two very special guests that I want to introduce to you all because today we're going to be talking about what it's like to be a mom and a family who experiences preterm birth. What it's like to live with babies who are born early, who are in the NICU, how that really goes. So we're going to be hearing the real raw experiences of two moms today. So make sure you keep watching. All right, Super Mamas. So today I have two of my girl gang with me. I'm so grateful that they were willing to come on and share their stories with you guys because it's so easy to sit here and talk about all the things that I know as a physician. But one thing I don't know is what it's like to have a preterm baby. I've never gone into preterm labor. I've never had a baby in the NICU. I've taken care of moms who have had this, but what is it really like on the other side? And so today I have two very special guests I want to introduce to you. First is Mia Blandingburg. She is a mom of three. She is a clinical researcher and a fellow Alpha Kappa Alpha woman. And I've known her for so many years, and she's going to be sharing her story with us today. And then also a dear new friend of mine, a member of my girl gang, Mrs. Tashara Todd, who is a mom of three as well, an entrepreneur, and the owner of I Am Beauty Boutique, honey. If you see my jogging suit I got on, so make sure you check out her website at iambeautyboutique.com. And if you use the code JOY2022, you too can get you a couple of cute outfits. Welcome these two ladies today to talk a little bit about their experience. They both experienced preterm birth. So Mia, let's start with you. Tell me a little bit about your first pregnancy. Like what were your expectations? I know you actually got pregnant with twins, right?
Yes. That's a big wow within itself, right, Joy?
Right.
When you see the two little heartbeats, on the ultrasound, that's a game changer for sure. So just adjusting to the fact that you are going to be a mom of multiples within itself is a big pill to swallow, right? And so when I did discover that I was, pregnant with twins, me and my husband were, adjusting to that life. But, in speaking in regards to preterm birth, my doctor informed me at the very moment that I had twins, that would be a possibility. So, I always kind of had it in the back of my head, not really wanting to accept it, I don't think at the time, but I always kind of had that nugget because he was very forthcoming about it, that we were going to do everything possible, but with multiples, that's just always an option. And so from there, I made sure that I attended my doctor's appointments regularly. He even referred me to a doctor in Columbus that specialized in, preterm births and multiples. And so I was very much aware of, what could happen in regards to being a mom of multiples, I would say.
And Mia, that's so true. If you guys caught this video that I'm linking up here in the cards that talks about the risk factors for preterm birth, we talked about multiples, remember, because it stretches the uterus out and it kind of makes it almost as if you are term, like if you're at a term pregnancy, and it tricks the body into going into labor, and that can certainly happen. And so Mia, tell us a little bit about what actually happened with your twin pregnancy.
Sure. So I was around about 24 and a half, going on to 25 weeks, where I was experiencing signs of preeclampsia or toxemia, whichever term you prefer. And so I kind of woke up one morning and I was very swollen. When you're a pregnant woman, you're going to be swollen anyway, right? But when you have toxemia and preeclampsia, as you know, Dr. Joy, you have a bit of a different swelling in terms of like the, edema in your hands and in your feet and kind of feeling like everything's about to pop. And so I also felt kind of lightheaded, which also that comes with pregnancy, but in a different way, because my blood pressure over the past, couple of weeks of me going in was creeping up a little bit, right? And so he was very hyper vigilant in terms of, saying, hey, we really need to watch this. But one morning I woke up and, this is the biggest part that I will say. Listen to your body. I woke up and I was like, this something is not right. And so my husband and I went to the doctor, and that's when, they kind of confirmed, okay, this is preeclampsia, this is toxemia, let's jump into action. So at the time, my doctor, who was working out of Lanier Hospital, which is in Valley, Alabama. And so I went there, and from there, it kind of didn't get better. They were saying, your blood pressure is still high because you have multiples. We really need to, kick it up a notch. So from there, I caught a fantastic helicopter ride to the University of Alabama at Birmingham, because they do have an excellent NICU unit there, as well as their maternal health section. And he just wanted me to get some more, centralized and focused care, especially because of the multiples. And so when I went there, Dr. Joy, I spent about a week and a half there, because they said, hey, you're not going anywhere, you're on bed rest. And then at 26 weeks, I woke up one morning having contractions, very, very strong contractions. And that's when we found out Miles and Mason were ready to come, even though they were at 26 weeks. So I was rushed to have a C-section. And from there, they were born. Miles was 1 pound, 4 ounces. And Mason was 1 pound and 13 ounces. So they went straight to the NICU. I went straight to sleep, passed out, because, like I said, I was having blood pressure issues, amongst other things that were going on. As you know, when you have preeclampsia and toxemia, your heart is working double overtime. And so I was very fatigued after that. And so I would say I didn't get a chance to see them for like a couple of hours, because they had to go straight to the NICU. I think the most dire part of it all is that, being in a foreign hospital where I'm not with my doctor, right? My doctor, he was constantly calling me on the phone, but he wasn't there. And so, kind of just having to adjust to that. I will say that probably they didn't have the best bedside manner when it came to kind of chatting with me about not only what was going on with my body and recovering from giving birth and toxemia, but also what was going on, with my children. And so I like to tell the story that they told me that, my twins wouldn't make it 48 hours, and here they are. They'll be 14 years old this year. So
wow,
that's something I'm sure we can talk about at a later moment. But they stayed in the NICU for about 3 months. So until their adjusted age, they of course graduated, from NICU to PICU to critical care, and then on to home. They were eventually moved from Birmingham to Columbus. But Miles, he came home on oxygen, and Mason was able to be a big boy and not have to do that. But many other things, of course, as you know, with preemies along the way to get them developmentally back on track. But I think the hardest thing for me was not just being with my own doctor, but also having to leave the hospital without your baby. When you're pregnant, that's the thing that you look forward to, taking your babies home and bringing them into their room. And, we hadn't even had their room set up because I was only 26 weeks. So I was definitely not expecting that to happen. But, God's grace carried me, and just also having a big support group. But not only that, I will say my maternal health, I think, was a little bit neglected at UAB, but the pediatrics were very, very good. They were very, very hands-on in the NICU and in the PICU, and informing me of what was going on and providing the care that they needed. So most grateful for them for that aspect.
I'm going to write that down about maternal health being neglected, because I want to come back to that. But first, I want to get to Tashara, and I want you to tell us a little bit about your first baby and your second baby, about like what your experience was like.
Well, with my son, who is actually the same age as me, as twins, my son will be 14 coming up as well. At first, it started out great. I thought that, it was going to be a normal, typical pregnancy. And all of a sudden, about 4 months, at the 4 month mark, I began to contract. And I didn't know what a contraction was at the time because, of course, it was my first pregnancy. So I called my doctor's office. Of course, they told me to come in. I told them I was hurting, very bad. I got to the doctor's office and they were like, okay, you got to go to the hospital. I get to the hospital and I am dilated to a 4 at 4 months. So immediately the game changed. I was taken out of work, put into complete and total bed rest. I had a home nurse issued at the time. Now, the technology, I guess you could say, was not as high tech as it is now. I had an actual home nurse that would call from Atlanta, and they had me hooked up to a monitor at home that would tell them if I was contracting. And if I was, then they would actually send an ambulance if I did not have anyone to bring me to the hospital. I also had a pump that injected progesterone, if I'm not mistaken, that's what it was, inside of me. And I was supposed to just be on bed rest, not get up unless I had to go to the bathroom. Well, of course, being at home and you're tired of laying in the bed, you sometimes get up and, I would try to do a little bit more moving sometimes than probably what I needed to being in the house. And every time I did that, I found myself back at the hospital. By 5 months, I was dilated to a 5. And at that point is when they put me permanently into our local hospital here in LaGrange. I was okay with that, actually, because I just wanted to make sure that my baby got here fine. And then after being there for approximately about a week or 2, I discovered that I was not going home. So it was no longer okay with me at that point. So I'm kind of begging to go home. They're not letting me. So the food, of course, was awful. The nurses on the staff at that time were very good, though. In the pregnancy, 4th floor, put it that way. The nurse was actually really good. Well, all of a sudden, one day I got in the shower at the hospital and I went into complete labor and they could not stop it. There was nothing they could do for me at West Georgia. On that particular day, though, it decided to storm. They had called in a helicopter and then the weather was too bad. So they ended up having to call in a special ambulance to get me to Columbus. They sent me to Columbus Medical. I was rushed there. I cannot tell you much about that because I was actually completely knocked out. I only know the stories that my family have told me. I woke up and, like I said, bits and pieces. I can kind of remember when I woke up and I was just very sedated, very droggy. I was in front of a whole new staff of people and they kept asking me my name and my birthday, and I think I could tell them that much. And then I saw my mom and she came in, so she was able to answer their questions for me, where they ended up putting me in the ICU because that same night I ended up having allergic reactions to certain medicines that they were trying to give me to prevent the labor, and my blood pressure began to rise. And they ended up having to, basically they was trying to say that I was having a heart attack. Basically, I was getting ready to go into I was in heart attack mode, is the phrase that they were using. So they were running in and out the room. I remember that. The next thing I know, I was out again, and they woke me up on the 4th of July. I remember that they let me see the fireworks. At that time, I was probably out about 2.5, 3 weeks. I had been out pretty much, just pretty much sedated. At that point, they pretty much started to come in and tell me that my baby and me would not make it. That's what they were telling my mom. They actually called in the priest of the hospital and had them to come in and pray over me. But of course, with our family being a praying family, we was not going for that. They was trying to make me make a decision, basically, to go ahead and abort the pregnancy in some form and to save myself. But we decided that was not the best option. So we decided to press forward, and I was able to come home after being in Columbus, I think about 2 months. I was in Columbus about 2.5 months. I was in Columbus, and then I came home and I was delighted to be home. My family cooked me my favorite foods and I ate, and that night I went right back into labor. So I ate it.
Oh, wow.
So I ended up back at West Georgia that night, and I ended up staying at West Georgia for approximately about another, I think, 3 weeks. And finally, it got to the point where I could not use the bathroom. I had to urinate and I couldn't. No, Schaffler was my doctor at that time. He came in and he's sitting in a kidney specialist, and the kidney specialist was basically like, okay, everything is crashing at this point. We need to go ahead and move forward. So that's when he came in and broke my water and had my son. So that was the deal with my son. The care was good though. I could tell, like Mia said, you're in a whole nother hospital without your doctor. But Dr. Schaffler, he was there for me every step of the way. He called every chance he got to make sure that the care was being given. And then with my daughter, I kind of knew what to expect, but I had to switch doctors because Dr. Schaffler no longer delivered. So when I found out I was pregnant, I was like, okay, hopefully we won't go through this again. Well, I had a new doctor, and he was telling me, you're not contracted, not this early. You're not contracting. You don't know what that is. You're not. I'm like, I am contracting. So we literally bumped heads really, really bad in the doctor's office. And finally he was like, well, I'll put you on a monitor just to put you on there. I was 4 months. I think I was about 4.5 months. And he put me on the monitor, and on the monitor in the doctor office, he saw that I was contracting. So only thing he could do at that time was apologize to me. And he was like, we got to take action and we got to do it now. And so he had his nurses to send me up to the hospital. I stayed there, I think about 2 days, and they got everything under control. And then he had a home nurse to start coming to my house. And on every Friday, I had to get the P17 injections. My daughter, I ended up contracting it some more after that. Even with the P17, I ended up contracting more. And I think by the time I was 6 months, I was approximately about a 6 already dilated. So I was on bed rest with her as well. Me being hard-headed, I decided, hey, I got bills to pay. I'm going back to work. I went back and did a couple of heads at my salon, and in labor, I went. So that was my lesson from that. I learned, and so they ended up keeping me for a little while there at West Georgia, and then I was able to come back home. I made it to 35 weeks with her. I made it only to 34 with my son. She was healthy. She came out 4:13, and she was able to leave the hospital with me. My son, I had him at 34, and he was able to leave. He was actually 5'3", and he was actually able to leave the hospital with me as well. So I didn't have to leave the hospital without my kids, but they were very tiny. And of course, my son had some breathing issues off and on, and different little things that we had to go back and forth for Atlanta with. But the care overall was really good, and I did not have to go to Columbus with my daughter. So that was a better pregnancy. But
I'm just sitting here listening because actually, though I've known both of you, I never knew these stories. Like, I mean, I knew that Miles and Mason were born at 26 weeks. You know, I knew that. And I knew, Tashara, that you had a baby at 34 and a baby at 35, but I never knew the details of these stories. And I'm sitting here thinking, oh my God, like this was traumatic. This was really traumatic. Like, you guys went through some crazy stuff. Transferred to different places, not being with your doctors, being away from your family. That whole hospital, I call it hospital incarceration, where you can't get out. You stuck in those four walls, you know, and it's like, please, can I just go outside? And we're like, no. Right. You know? How did that feel to you guys? Either of you could take that answer. Like, what was going through your head when you're like, I'm already, 6 centimeters dilated, or I'm stuck here, I cannot get home. Like,
I was in Birmingham, so I was like 2.5 hours away from family. So they were taking shifts kind of being with me. So my husband came first, but he was like, okay, I'm gonna go back to work. I don't want to go back to work, but I'm going back to work because your mom is coming. So she stays for a little while, then grandma. And actually the day I went into labor, my husband wasn't there. My dad and my brother were there with me. So my dad was actually in the room with me when I had my C-section. And so I'm very grateful and glad, but my husband, he always reflects that he wasn't there. So those kind of things when you're not with your family and he's having to drive so far and he's worried about his babies, he's worried about his wife, it's so much going on, especially when you're in a foreign hospital. And like I said, my Dr. Bendala, he was very vigilant about calling me, about calling the staff and like, she belongs to me. What's going on? Tell me what's going on. This is my history. But you're essentially alone. You have family coming in and out, but they don't know you. The staff there doesn't know you, and they try to make you comfortable, but you definitely feel a little bit like you're in jail a little bit because you're not getting out of that bed. I think they had a little activity class that they rolled me to one day, and we talked about our feelings. I think we painted a little bit, but you want to be at home. So it for sure was definitely a jarring experience. I think it's the best way I can, describe it.
Yeah, and then what about you, Tashara? How did you feel? Like, what were you thinking, especially the second time when you had another baby at home and you're like, oh, let me out of here?
I think I would say I was depressed. I'm gonna be honest. It was a lot because, especially with the first one, because at the time, and I don't know if you guys remember this, that's when gas was like $4. So when they moved to Columbus, I had all the visitors in the world in LaGrange, but when they moved to Columbus and that gas was $4 and some change, that was the first time it ever happened around here. People were not trying to come see me. So it was harder. My mom, she never left my side, of course, but my pastor would come and stuff like that. But as far as my friends and stuff, they was just calling, and it wasn't the same. As far as my daughter though, when I found out that I was basically about to go through the same thing, I think I really started being depressed because I was just like, oh no, not again, and I have another son here who's gonna take care of my son, because everybody in my family works. So it was kind of like, this is not good. Like, Lord, please don't do this. Like, I think I was begging every day, like, Lord, please don't. But overall, it turned out well. Like I said, the only time I was in the hospital was 1 or 2 days with her, so it wasn't that bad. But the first time definitely was depressing.
The financial element of it, right? Like, you're out of work because you're at the hospital, you can't go anywhere. So, God forbid if you don't have short-term disability or, PTO days. Luckily I did, but trying to work on paperwork while you're sitting in the hospital, worry about whether you're about to go into labor. And then, you still have households to take care of. And I'm sure Tashara can definitely relate to that because she already had a son the second time she, went into labor. So you think about all those things too. And it's very depression, and it makes you anxious that you can't, everything is out of your control. So I remember for sure when I was pregnant with Miles and Mason that I was like, I don't know how to fill out FMLA paperwork, or, I don't know what's going on. I'm trying to make all these phone calls and they're telling you to stay calm when that's the last thing that you can do, And
that's something that a colleague of mine, Dr. Moore, brought up. She was like, we don't, as Black women, always have the leeway that some of our other colleagues have when it comes to finances, when it comes to work, when it comes to support networks, because we may have to be trying to handle that business from the hospital, from wherever we find ourselves, and that can be very difficult. And when I was talking in the last couple of videos about the top 5 causes of preterm labor, and I got down to number 1. Guess what it was? Stress.
Yes. It
was stress. I want to go back to what you said, Mia, about how your baby got excellent care, but you felt like your care may have been less important to the team. Talk a little bit more about that.
Sure. So, like I said, I was in UAB. Miles and Mason, of course, had to stay in the NICU. And so they released me. But when they were getting ready to release me, to go home, I'm like, but I don't, feel so great. I know I just had babies and you're not supposed to feel so great after labor, right? But something was not right. I was still very, very swollen. I felt very lethargic. My blood pressure was continuing to be up a little bit. And, they were saying it's normal. You'll be fine. Not to mention, where I had my C-section, the scarring was horrific and, leaking and a multitude of things that your body. And so, if something is not quite right. And I kept expressing that to them, but felt as though I was being ignored. And so when they sent me home, even though, I pleaded for them to keep me an extra day, they kept me an extra day, but still sent me home. So as a result of that, when I got back to LaGrange, I immediately called Dr. Bendall. I was like, listen, I'm back, but I'm not feeling myself. I know I just had a baby, but I'm not feeling myself. End up having to go to the ER in LaGrange, not even 24 hours after being back, and got put in ICU. My heart was basically swollen. Blood pressure was still high. Body was still swollen. I mean, I was close to almost 200 pounds, and most of that was fluid. So, my heart was working overtime, my lungs working overtime because of that excessive fluid. Had to stay in ICU for about a week, in the regular floor for about another week, just to get my body back to normal. So, that's what I said about, kind of listening to your body, not knowing what's going on, especially when that's your first baby. I feel like, somebody somewhere should be saying, hey, this is normal and this is not, but also listening to you when you're trying to advocate for yourself, which I feel is very important. When I had my daughter Meadow, she was, of course, full term, but I was here in LaGrange. So, my doctor, he listened to me. And I'm like, she was born at 38 weeks because my blood pressure was just a tinge too high. And he was like, we're not doing that. Right. So, trying to advocate for myself, I felt as though, they were not listening to me. And as a result, I did have to go through a lot of hospitalization, even aftercare, after that fact of just trying to get my body back. Even though they are 14 years old, I still kind of suffer from some of those lingering effects of, being pregnant and going through the preeclampsia and the complications of that. So, especially I think also because I was an African-American woman and, I didn't see a lot of me represented there. I didn't have a nurse of color. I didn't really have a doctor of color. I maybe saw one or two nurses, in the OR going into my C-section that maybe was of color. But to me, that's important. Not so very important, but important enough where if I'm trying to voice a concern, somebody somewhere should be listening to me, right? That there's an issue.
Yeah, I think that is absolutely important. A team of my colleagues and I actually just put out some research on healthcare provider perspectives when it comes to caring for African American women. And just some of the perspectives were quite shocking, is what I'll say. And I'm sure one day I'll probably do a video on it when I'm not so deep in my feelings about it. Absolutely right, is that sometimes we get so caught up in what we're doing and we forget to listen to the patient. And it sounds like you had a heart condition that can be caused by preeclampsia, which is what's called peripartum cardiomyopathy. It's the number one killer of women, the number one killer of Black women particularly, and the number one cause of death around the time of birth in Georgia. So, we have to be very cognizant of that. And that is a big move that we are making here right now in this state to put out safety measures for cardiac problems around the time of birth, like during pregnancy or right after delivery. And sounds like you also had some heart problems too, Tashara, which was very interesting. And I'm wondering about this whole pump thing, and if you weren't getting terbutaline, which is a medicine that helps stop your contractions. Terbutaline pump. We no longer use those because we know they can cause heart toxicity. So, these are things that women go through, but they can be very traumatic. And so I was just wondering, did either of you ever have an opportunity, either, with a professional counselor or even just with really close family friends that you trust that have wisdom, your mothers, your aunts, the mothers in your churches, have a time to really kind of like debrief these births and these situations, because PTSD after traumatic birth is real.
I did not at first. I eventually did. I did not actually seek counseling because growing up, we've always been told it's okay. Just, you kind of swipe it under the rug and you move on with life and you tough it out. But I began to realize, I'm like, this is playing an effect on me emotionally daily because of the things that I've been through with both pregnancies. What made me actually go get counseling itself was not the pregnancies. What made me get counseling was my daughter's father was murdered at 3 years old. So that in itself all took a toll on me at that one point. So when I was seeing a counselor, I did bring up the preterm pregnancies and the effects that I felt like it had on me, and the fact that I felt like at that time I was beginning to kind of, I guess you can say, spiral emotionally, because I've always been one that never cries about anything or never shows any emotion. So yes, it did definitely. I did actually finally go and talk to someone, and I think that was probably one of the best decisions that I ever made, because there was a lot of anger and hurt, because like Mia said, you do feel like you don't get the same care. And for me, I kept saying, well, maybe it's because I'm on Medicaid. I kept saying that I felt like that was a problem. And that's why with this pregnancy, I refused to do Medicaid, because I wanted to be treated equally.
I mean, so what was different about the third pregnancy for you, Tashara? Do you think it was your insurance? Do you think it was where you were? Honestly, over 60% of births in Georgia are covered by Medicaid. So, you cannot be an OBGYN and expect to eat and, treat your Medicaid patients back.
Right.
I'm just saying, like, from a business standpoint, it don't work. So there is a silver lining here, Tashara. Like, for you finally had a pregnancy that almost made it to term. Like, you got to nearly 37 weeks. So tell me about your third pregnancy. What was different this time?
When I switched providers, I felt like my needs were actually being met and I was being heard. Going into the first couple of months of the pregnancy, I was with a different provider, and I felt like they did not hear me, or they did not want to hear me. Basically, I felt like I was being told that there was no preterm issues, and that my other pregnancies, by them being 8 years old and 13 years old, didn't have any effect on this one. That's basically what I was being told. I was being told that it was an illusion. I mean, literally, those were the words that were used. This is an illusion. You'll be fine. Let's just carry on. Some days I would be hurting so bad that I couldn't hardly walk. And then I transitioned. And that is when I felt like, okay, I'm being heard now. I can tell the difference in the care that somebody's concerned here. And I think that's the main thing, is Black women, we kind of get pushed to the side a lot in a lot of doctor offices, and it kind of makes you feel like, okay, well, never mind, and you just kind of go on and you get angry and you say, well, I'm not going back, and then next thing you know, you have a bigger health issue than what you originally had. So I'm thankful that I was able to feel heard and feel cared about, because I mean, honestly, I was beginning to get depressed at that beginning stage again, because I thought that I was going to go through it and not be heard.
Well, I'm so glad that you felt heard and you felt that you could express yourself, because that is so important. And sometimes people have this perception that Black women are not interested in their care, that they're not interested in going to prenatal care visits. But when you, on the flip side, ask Black women about how they perceive their care, many of them say exactly what you just said. Like, I didn't feel heard, I didn't feel seen, I didn't feel like they were interested in me, and so I just decided not to go back. It wasn't that their health is not a priority. It's just that they feel like, why am I going and waiting for an hour or more for someone to come in for a few minutes and not listen to me? I could be at work. I could be doing something else. I could be taking care of other business. So I think that is definitely an important conversation to have. And I often talk to moms, and I would love to get your closing remarks about, moms who are just so tired and they're trying to make it to the finish line with their pregnancies, and they'll say, oh, just, will you just deliver my baby preterm? And I say, absolutely not, because prematurity, these babies have a hard time. They're tiny, they're fighting to gain weight, they're fighting to eat, they're fighting sometimes just to live. So what would you say to a mom who just wanted to have their baby preterm when they didn't have to?
I would say, from my experience having preterm babies versus a full-term baby, let that baby bake as long as you can. Just seeing the struggles that my sons had to go through, even though now, they are finally, on level with things, but they struggled, right? They had to have so many kind of therapies I can't even begin to name. And, when you think about that, you want to give your baby the best chance, right? Both in the uterus and in the world. So the longer that they're in there, that's the place that they need to be, right, until it's time to come into the world. So it's difficult and it's hard, but it's worth it. When you're able to carry that baby as long as you can. We are blessed with a special gift to give birth. I think it's a blessing, and so we kind of sometimes have to endure those hardships, but I wouldn't trade anything in the world. I always try to advocate and talk to women who are either experiencing or facing preterm birth or have had preemies, because if you had never had a preemie before, it's difficult, it's hard, and it's a long road ahead, but it can be done. So I'm really glad that you're talking to us, because they can hear our stories and know that there is another side. Sometimes when you're on this side, you can't see the other side. And so it's very important that you can hear somebody who's been in your shoes and can tell you, hey girl, you can do it, girl. You're going to make it. Now every day is going to be easy. And yes, you're going to need some support. And yes, it feels kind of depressing, sometimes, but you can make it. And you can do it. So definitely, I thank you for allowing me to have a voice on your platform, because hopefully that will give somebody, inspiration to make it.
Well, I so thank you. What closing remarks would you leave with our super mamas out there, Tashara, who are dealing with preterm birth or who are just struggling to get to term? They feel like it's just so hard.
I would definitely say, hold on. It will be okay. I remember coming into the doctor office and like, please, Lord, like I am hurting. I am big. I am, I am a lot. And it was a lot. It was a lot to deal with as far as the extra weight and all of that you gain. It's a lot to deal with without the sleeping. It's a lot to deal with on every level. But just as Mia said, let the baby bake. Let the baby bake so that the baby will be fine. Having this last baby now, I'm looking at him daily and I'm like, okay, you're little, but you're strong, because I don't have to I haven't had to deal with any of those other things that I had to deal with my other two, as far as him not being able to eat or hold down formula and all of those things like that. So that gives me peace daily, which definitely does not put me in a place of depression or anything of that nature. So as long as you let your baby bake and get to full term, as close to full term as possible, everything on you would be a lot easier. So you have to think about it in that term. And like Mia said, I'm definitely thankful for you giving us this platform to be able to talk about this, because it is a subject that needs to be talked about. The preterm pregnancy, the care amongst us, and all of everything that's been discussed. And I appreciate you for this platform.
Well, I so thank you for being willing to share your story, and that's just so courageous and brave. And I am just in awe of all the things that a lot of women go through, and that they just are so strong to face it. And I'm so glad that people are willing to talk about it, so that other people can see the testimony that you guys are. All right, super mamas, I hope that you got a lot out of this conversation. I know that I did. I feel so just blessed to have been able to hear these stories and to be encouraged by them. Make sure that you go and check out Tashara's website, IamBeautyEboutique.com, and get your jogging suits. This thing is so soft and I just love it. I've been wearing it all day, and you can get a discount by using Joy 2022. If you have any questions or comments, go ahead and put those in the comment section below, and make sure that you subscribe so that you don't miss a single Super Mama Sunday. And we'll catch you next Sunday. Peace.